Also, the importance for the general public is that they would have an input into how we value outcomes in some of the research that we do. Traditionally, in critical care medicine, the major outcome has been survival. And survival, as we're becoming more and more aware of, may not be the most important thing. And then some people value outcomes, value things like quality of life, value surviving without dysfunction, and may be willing to accept maybe a lower chance of survival if their quality of life is better. Or maybe survival is the most important outcome, but traditionally we've never involved patients and citizens in that decision process. It's been decided by the research community. And I think to get research adopted and important and more relevant to the population, we need to do this in critical care, which has never been done before. And this funding will actually help us start this research program to make it wide scale in scope so that we can actually inform things going forward, and it would be applicable to a lot of research studies that are currently that are maybe starting up and will be done in the future. So sometimes research has been done, sits on a shelf, has never been used. But if you actually make it more relevant to stakeholders, and stakeholders, I mean that broadly, it's citizens people who've never had the critical illness, patients who've had critical illness, and other stakeholders, decision makers, funders, then it's much more likely to be more relevant and to be more easily adopted. Well, local funding is important for a couple of reasons. The first one is that to start these research projects, it's very difficult to get seed funding. And seed funding allows you to be competitive at getting more bigger research grants, which can take this research to the next level. Second of all, local funding again means that the community is behind you, gets back to that circle, to that loop, that the people who are actually funding the research actually are going to have some input into our results. So if you want to participate in my research, please feel free to contact me. I can be reached through Kingston General Hospital or through Queen's University. My contact information is listed there, and an email would be great, and we would get in touch with you about scheduling follow-up time, explaining the research further, and seeing if there's ways that we can have you involved. The more people we get involved, the better. So this initial phase is a very preliminary start, and we envision this to be a much bigger process going forward. This type of research typically takes years to conduct. This first phase should be finished within this upcoming year, but it will become bigger as we go along, and having more people engaged in this will be very important for us. This will allow us to start up a research program, and this type of funding is very difficult to get elsewhere, and really appreciative.